Today we have a pleasure of speaking with Dr. Rami Shasha, the distinguished ophthalmologist, a very important innovator in the field of cataract surgical techniques. So Dr. Shasha is renowned as double board certified both in Canada and the United States, and he's renowned for his contributions in the field of surgical education as well as development of his own surgical techniques. So Dr. Shasha, thank you for joining us today.
Thank you, and thank you for inviting me to speak with you.
So the first question is, could you share with us what inspired you to pursue ophthalmology as a career, and what aspects can you tell us that motivated you early in your years?
Yeah, it's a great question. So there's no ophthalmologist in my family. When I turned 16, I got my driver's license, and my grandfather developed AMD and was referred to as ophthalmologist.
Oh, wow.
And so I actually took him to the ophthalmologist, and right there I was hooked on, the surgery, the lasers, and of course I kept an open mind. But when I got into medical school, I explored all other specialties, but just ophthalmology just kind of stuck with me. There's a famous quote that says, you don't get to choose your specialty, the specialty chooses you. And I sometimes resonate with that because, like I said, nobody in my family is in ophthalmology. And so, yeah, what drew me is that, but also the mix of medicine and surgery, the finesse of intraocular surgery. And so that's basically how I got started into ophthalmology.
Yeah, indeed, our specialties offer so many things. When we're talking about your residency and your training, could you tell us some of the challenges? Because many of the young ophthalmologists and many of the residents find this period of their life very challenging. What did you do to overcome those hurdles, and what was your approach in your residency, basically?
Yeah, so I mean, there's always going to be challenges in residency, and it's going to vary, every 5 years. I mean, one of the most recent challenges, which didn't impact me, but as you know, during COVID, a lot of residents had no opportunity to do any kind of surgery. During my training, that did not impact my training. But for me, I would say just, what a lot of residents worry about is if they're getting enough volume or enough cases throughout their surgery. And so being bold with the program director and asking them, this is how many cases I've done, and I want to do more and more. Sometimes they'll modify the schedule so that you can get more cases in, getting the right variety. I think surgical numbers is always something that a lot of residents think about. And another issue, of course, during your residency is trying to figure out what you want to, specialize in, and that can also be a challenge. And so making sure that you get adequate exposure to different areas in ophthalmology.
Okay, yeah, I completely agree. Maybe we can elaborate a bit on this question. How was your approach to surgical volume, and even the cases that you got, did you reflect on them? How was your approach towards reviewing the cases and trying to learn from your mentors and your own mistakes?
Yeah, absolutely. So in terms of reviewing cases, we are very lucky. Nowadays, we can record our own cases. And if the training facility does not allow you to record, you need to, advocate. Because the best thing is we're no different than, let's say, athletes that go home and watch their own videos. But you learn by doing surgery, but you learn also by recording the case, going home and watching it. And then you also learn by watching other surgeons that post online. I mean, we're very, very lucky. In the 90s, you and I would be ordering VHS tapes from surgeons from around the world, and it's, we're very lucky when you take the opportunity. So I recorded my cases. I would always, at the end of every case, write down what I did well, what I didn't do so well, and then also getting feedback from my preceptors. And I think that's really, really key. Your learning curve will grow very quickly if you're constantly doing things like that. So that would be my approach, and obviously I also use the wet lab. So if your facility has a wet lab, use that as an opportunity to also learn.
What about simulation? Did you have a chance to use any simulation at your institution?
Yeah, great question. At that time, it wasn't as popular. We were just using pig eyes, which are okay. But the new models like Simuli and I think it's called Bionico, they are very excellent. And I would advocate that every residency program should have them. Now, not all of them do, but I find are more reproducible than things like pig eyes and things like that. And they're also cleaner. There's of course a cost to it, but But in terms of practicing sutures, throwing sutures, things like that, that's how you get better as a surgeon, and you can get direct feedback with your preceptors.
Perfect. I read that in 2019, and I've actually watched your videos. You developed the so-called the Shasha Sequence technique in cataract surgery, and it was recognized, of course, by the American Academy of Ophthalmology as a new technique. Could you tell us a bit about that, and how did you come to develop it?
Yeah, it's a great question. So basically, when people say, how do you come up with a new technique? I always tell them, if you're trying to come up with a new technique, it won't happen. It has to happen naturally. And how do you develop a new technique? It was because I was taking on difficult cases. So the nice thing about difficult cases is that you'll come across a scenario during surgery, because a case is difficult, where you get stuck and you don't know what to do. Okay. And so in complex cataract, sometimes pieces don't rotate, and they don't rotate not just because you didn't do a good hydrodissection, but just zonules and things like that. And so you have a heminucleus that just doesn't want to rotate. And we're traditionally taught you got to rotate it to the other side to continue the surgery. And so I just wanted to go outside the box and say, well, let's not do that. Let's not rotate pieces. And so I came up with a bimanual technique where the chopper wraps around, basically manually dissects the heminucleus, and then you're just on position one, just rotating the piece to the center and then bisecting it. And so it came more as a necessity more than anything. And I use it for complex cases. You can even do it for routine cases because it saves that extra step of having to rotate to the other side. And we do know every time you rotate, you can stress zonules as well. So that was a technique that came to me probably within the first couple of months when I, in my, independent training. And like I said, people, not everybody likes doing the tough cases, but if you do routine cases, there's not much opportunity for innovation and things like that. So.
Yeah, I completely agree. And I think you mentioned in one of your videos that basically by developing this technique for complex cases, this gives you another tool to use even in a routine case where you're having a bit of trouble.
Absolutely. And also, I mean, even cases like posterior polar cataracts, or if you have an anterior capsule tear where you don't want to rotate to the other side, because they say if you rotate for posterior polar cataract, you can put stress on the posterior capsule.
Yeah,
so it has utilities in many scenarios. The only downside, of course, is it's a very bimanual technique. So I always recommend surgeons to develop both hands. And so even in your residency, people say brush with your non-dominant hand. I don't really agree with that. I would say practice using your non-dominant hand and practice drawing or writing. And that's how that kind of mimics intraocular surgery. Brushing your teeth, if you look at your hand is up here, it's just not the same thing. But if you especially drawing, I would say, because ultimately, the more difficult the case, the higher the demand for bimanual surgery and things like that.
I completely agree. And talking about education, you've established yourself as one of the ophthalmology's biggest educators in basically interior segment. And I really admire your videos, especially the small tips that you have. Obviously, you had a very complex case, but you managed to extract the very essence, the very complex part of it, and then you present it in a very simple way. So could you tell us about your thought process there, and could you tell us about what is your motivation on being such a good educator?
Well, thank you very much. So just like with new techniques, this just came out naturally. So I started doing teaching online in my second year as a trainee, as a resident. If you go way back to my account, it wasn't surgical. It was mnemonics about how to remember random things like Marfan syndrome and loose zonules, or all these rare symptoms that you learn about. And so this was in 2016. Instagram wasn't known for education. It was just like people posting photos. Just one night I said, you know what? I'm just going to start posting in Instagram images and videos. And again, as I tell people, because people say, how do you create an account with a large following? Well, I tell them, if you're trying to create an Instagram account with a large following, it's not going to work. It has to happen naturally. Does that make sense?
Yeah.
And so I was just posting because I enjoy doing it. I didn't know it was going to grow. Thankfully, it did grow, but I did it for my own joy. And then, when I hear that people were getting some feedback, it kind of motivated me to continue. And then And then I started posting surgical videos actually after my residency, and it was initially routine cases. But to answer your question about focusing on something specific, well, I like to post on Instagram. Instagram has people with a short attention span. It's not like YouTube, so people so you want to have the video short. And I do think that I want the audience to get the point of the message, and so I like to zoom in. So with editing software, you can zoom in exactly what's going on, and it helps them overcome a scenario that's unusual, or what I did to kind of overcome that. And that way it's like rapid fire. And honestly, a lot of conferences are like that. I just came back from the the ASCRS meeting, and now they have this high impact Pearl session where you go up and you can only post something that's like about no more than a minute. Does that make sense? So people, it's nice to watch a routine case start to finish as a resident, but when you become a consultant, you kind of know how to do those things. You want to just highlight something. And so sometimes I'll do a case in the morning and something interesting happened, and I'll go home that same day and just post it or post it the next day. That way it's still fresh.
Yeah, we definitely love your content. I have a very interesting remark though. I mean, imagine like a young ophthalmologist, like fresh out of residency. Of course, you're dealing with all those complex cases with like zonal weakness and difficult cataracts. And of course, everyone is aspiring and looking to you, and looking to be you one day. So what would you say to those young ophthalmologists that actually want to be in your shoes, walk to this complex surgery path?
Yeah, it's a great question. It's hard to answer. I think I decided to do complex cases because it's kind of hardwired. I really enjoy doing it. I gravitated towards it naturally. And so the resident, they have to have that, right? So if they don't have that, they have to find what that is. I do believe everybody has a specific niche that they go in. And once you find that niche, it won't feel like work. That's the secret that I tell people. If you go in there and you just enjoy it, it's like being in a comic store or something like that, then you found it, right?
Like your thing, yeah.
Yeah, and that's the challenge of the residency. Do I do pediatrics? Do I do oculoplastics? Now, if you are this person watching this and you have a interest in complex surgery, like the way I did, well, then yes, you have to take on those difficult cases in the beginning, and it's going to be challenging. But the only way to grow is to do those kinds of cases and tell your colleagues in the community, I want to do these difficult cases. And next thing you know, your colleagues, they don't want to do these cases, by the way. So they refer to you. So when I came into the city that I work in, I told them, even though I just graduated, I said, listen, I told the whole group, I like doing difficult cases. I like to do this, this, and this. And they were all on board. And then my practice quickly became a very complex practice. And then word of mouth spread, and then other cities started to do the same thing, and that's how you do it. But just find what you're passionate about, and that is the engine really that keeps things moving. So,
perfect, great. Maybe we can ask you about. So you obviously we talked about the Shasha sequence. Could you tell us about other complex technique that you develop and use routinely in your cases? Or in complex cases?
Yeah, so this is an instrument that I designed. It's a little bit more for, again, complex surgeons. Sometimes we have to pass needles blindly from the conjunctiva through the sclera, and it's in a very delicate area called the sulcus.
Yeah.
And it's actually a blind pass, believe it or not. You can't actually see, once the needle pierces through the sclera, you can't see where it is because the sclera is white. And so what the problem is that the needle, as it goes in, it may engage the anterior capsule and cause an anterior capsule tear. And so when we're putting in capsular tension segments and things like that, we have to pass needles. Yes, you could put viscoelastic above the anterior capsule and create space, but there's no guarantee. And I have seen world-class surgeons inadvertently cause anterior capsule tears. They post videos about it, especially if you're angling from the nose, because you can't flatten out. Exactly. And so the problem is, if you're planning on putting in a capsular tension segment as an example, and you cause an anterior capsule tear, well, you can no longer place a segment there anymore. It's catastrophic. And that one surgeon I have in mind, he was planning on placing a segment. He caused an anterior capsule tear, basically had to take the whole bag out because you can't put segments in and then do a secondary IOL fixation. So I said to myself, this is something that I also saw, like I'm just passing a needle, is we shouldn't be doing, as eye surgeons, we shouldn't be doing things blindly. So although it's still a blind pass, the needle going through the sclera, I developed a shield. It's an anterior capsule shield, which is how I called it. The company wanted to call it, or collectively, I guess, because it sounded well, the Shasha shield, which goes through a paracentesis. It fans out like a fan or a shield, if you will. It rests on the anterior capsule, and then the needle goes in.
Yeah.
Does that make sense? That way the needle cannot catch the anterior capsule anyway. And worst case scenario, it catches the shield and it's metal on metal. And that's what that instrument is based on. I've come up with other surgical techniques as well. I can mention those if you'd like, but in terms of instruments, the shield is kind of that new innovation.
And if we talk about your thought process there, maybe you discover a problem that is not solved on your complex cases, and then I guess you reflect on it, and then you think of a solution. So many surgeons just stop there and just try to do their best with what's available. What you have this you go this extra step, right?
Yes. Yeah, exactly. So you hit it right on the head. So I say, okay, there's an issue. How can we make it better? But again, though, it's hard for me to explain, but I wasn't actively trying to, it just happened naturally. You just do these difficult cases, and then you're driving and you're like, hey, we should do this. Does that make sense?
Yeah.
But the thought process is correct. Okay, we have this. How can we make it easier or better or safer?
Perfect. Our profession is great, and it's one of the role specialties which gives a very good balance between working and basically having a good quality of life. How do you balance your career and doing all those educational extra efforts in your personal life? Could you elaborate a bit on this?
Yeah, that's a great question. So, I mean, when you start doing surgical editing videos and things like that, it can seem time consuming, and it is, but the more you do it, it becomes very fast. And so I can pump out a video, depending on how long it is, anywhere between 5 and 20 minutes.
Oh, wow.
I do it every day. So just because it's effortless. I also enjoy doing it. So when I'm doing the video, it's like joy for me. But yeah, we're very lucky. I mean, with ophthalmology, our hours are good. So, spending a chunk of my evening doing videos. If I feel like I can't do it, I can do it on a weekend, and then you can make 6 videos on a weekend and then have them ready from Monday through Friday. But no, absolutely, being well-rounded is key. I mean, I like, hiking, traveling. I love traveling. I got into the guitar recently, so I've been playing that and many other avenues, keeping up with sports and things like that. So I do feel that by being well-rounded, you owe it, it's not only good for you, but when you see patients, I always find when you go on a vacation, you come back, you're looking forward to work and things like that. So it's not just work. But being well-rounded is key. But honestly, even making videos for me it's fun. It's not like I'm at work. Does that make sense?
Yeah.
And I'm looking forward to posting it and sharing it and that kind of thing. So it's almost like a hobby in a sense, and less like work.
I can totally reflect and connect with you, because going home and looking at your videos, editing your videos, you see so many extra things that you never saw on the R. So there's also an educational element to yourself by editing those videos.
And one thing I just want to highlight, people will only record videos that they think are going to be interesting. Like, oh, this is going to be interesting, let me record it. I tell people, record all your cases. Because sometimes it's a routine case, but something interesting happened, but you won't know, right? That's why you record all the cases and then delete the ones that have no specific pros.
Great. We have a lot of young colleagues that are actually passionate not only about learning surgery, but about education. What would you advise them to how should they approach to share their content, and what platform should they use? You can talk a bit about social media and your experience with it.
Yeah, I mean, if you think about it, I mean, this is a great time to do it. I mean, you're using these platforms. You can start on Instagram and use the same video on YouTube. You can make the video a little bit longer on YouTube, but we're very fortunate. Like, you don't have to pay to post these videos online. Maybe in the future, to post a video on Instagram or YouTube, you may have to pay. Because you're getting a lot of free benefits, if you will. But if they want to start, I mean, YouTube or Instagram, I don't know about. I'm not on TikTok. I don't think there's as much educational content on there. I could be wrong. And then even LinkedIn, I find LinkedIn, though, they tend to flag a lot of the videos, so they'll blur it out. But YouTube and Instagram, and honestly, start now, because every year it's getting harder and harder because there's more and more accounts. Like, I started in 2016, right?
Yeah.
And it took me many years to grow. And again, don't post for the sake of growing. Post because you enjoy it, and then it'll grow naturally. But I mean, in 2016, there was less people on Instagram. Now there's even more people. So it's, if you want your account to thrive, start now. And then just post whatever. It's not going to be good in the beginning, but it just gets better with time. And then just post what sometimes the problem that some people come up to me and says, I posted this video and it wasn't well received. I tell them, make the video. We had this discussion about it in Dubai, actually, with another make the video. If you feel like it's good, don't rely on the number of likes or views and things like that. Just post it and then move on. Does that make sense?
Yeah.
Because you can get stuck in the rabbit hole of feedback and things like that. I mean, that can, for some content creators, can be very emotionally draining and all that stuff. So I post and then I move on.
So quality content over quantity and seeking likes and shares. Yeah. Totally agree. Another thing young ophthalmologists are very interested in is, so what did you use other than the resource that you shared? What other resources can you recommend that are current, that are high yield, and give young surgeons the ability to learn surgery, to expand their knowledge and skills?
Yeah, so to expand, knowledge and skills, obviously, watching online, that is free. You can watch surgeons from India, from the United States, from Brazil. I'm a self-learner. I can watch a video and then apply it. Now, not everybody's like that. Some people are hands-on. So if you want to be hands-on, visit other ophthalmologists. We have the ability to email people directly. Yeah. Go to a conference. The conference has wet labs, one-on-one wet labs. Yes, there's a fee, though. And yes, it means flying to the conference. Or doing a 6-month extra training, a year training. We're all interconnected now around the world. Again, compared to what it was like in the 80s and 90s. But honestly, just learn, always learn. Even when you're done your training, you can always spend a month or a week with somebody. But honestly, I mean, we have thousands of videos now online that are free. And so this is the perfect time to be an eye surgeon.
Yeah. I completely agree, and we're so fortunate to live in such a good time with so many opportunities. Maybe just something to wrap up. You've obviously already had a very successful career, and you're still on the growing path. Congratulations! But could you share us about your vision of the future of your career, and what are you aspiring to? What are some interesting projects that you are working on, maybe that you can share?
Yeah, I'm currently working on a couple of things to try to make things easier. So it's still in the works, but with suturing IOLs, there's always the issue about sutures being entangled, and that can be a problem. So I'm currently working on an idea around that. So for me, the future is just to come up with new techniques, making things easier. I would say doing things differently. And I mean, this doesn't apply to me specifically, it applies to really everybody, but that the AI world is going to come in. It's coming at a so rapid pace, but how it's incorporated in surgery and how it's incorporated in medicine. I mean, AI is here to stay. It's legit. It has flawless memory. I mean, not always, but it can respond to you right away. It's going to have a role in management and things like that. It's very interesting. but for me specifically, I mean, obviously, just always trying to get better, and never feel like you've settled. If you feel like you're settled, then
You find it
just
best. Yeah.
even little things. I mean, and just obsessing about small little things, right? Like I remember my preceptor when I was a trainee, he used to use the wide tape rather than the thin tape to tape the patient's forehead.
Mm-hmm.
And I was like, and he's like, hey, he would always tell me like focus on the little things. And then a couple of days ago, I was operating on a patient. His head was moving, even though I put the tape on with the thin tape. Now I put the wide tape. He's like, he always tells me every little thing matters. The speculum, if it's working. So I'm always trying to refine things, and just getting better, not just in surgery, but in life, and just you can use that in all aspects of life. And yeah, that's kind of what my vision is.
Mindset of constant optimization and trying to be the best in many things, not only in specific like surgery.
Yeah, and when you say being the best, I mean, really, it's like basically like the easiest way to do is competing with yourself. Yeah. That's kind of the, it's good to see what other people are doing, but it's you become more unique if you are competing with yourself. Does that make sense? You don't want to be trying to copy what somebody else is doing. I think that's how you stand out. I think you just kind of do something that's unique, and that's something that you resonate with and that you're passionate about.
Perfect. Well, Dr. Shasha, thank you so much for sharing your thoughts, and thank you so much for this interview. And we really wish you all the best and feel a lot of success in your future endeavors.